Great. Our colleagues will join us. Yeah, those who haven't joined us yet will join us shortly. So I appreciate that. I hope, welcome back, everybody. I hope everybody had a good summer. We had a little time off. It's nice to see, or at least hear from all of you again. It's been hopefully a good summer for everybody, and I appreciate the chance for you, chance for us to get together again. Marcin, do you have any sort of opening comments for us?
Yes, Mr. Chair. This meeting is being recorded for minute-taking purposes, as well as for posting of the recording on the agency's website. This meeting is also being live-streamed on the Access Health CT website. Thank you, Mr. Chair.
Thank you very much. If I could ask for a roll call of the directors present at this meeting.
Mr.
Yep,
Mr. Charles
please go ahead.
Claypool?
Yes,
Chair.
thank you.
Thank you. Paul Philpott, the Vice Chair.
Here.
Thank you. Grant Rader?
Here.
Deidre Gifford? Steven Hernandez? Matthew Brockman?
Present.
Thank you. Thomas McNeil?
Here.
Thank you. Dina Berlin?
Here.
Thank you. Andrea Barton Reeves, the SCS Commissioner. Sean King from OHA.
Here.
Thank you. Claudia Gaultier from OPM.
Here.
Thank you. Paul Lombardo from Connecticut Insurance Department. Manisha Chutani, DPH Commissioner. And Caroline Zambetti, a designee for Nancy Navarrete, DMS Commissioner.
Here.
Thank you.
Thank you very much. I appreciate that. And if I could ask the members of the exchange to introduce themselves, starting James with you.
Good morning, all. James Michelle, Access Health Connecticut.
Gina Walsh, Director of Operations, Access Health CT.
Holly Zwick, Director of Finance, Access Health CT.
Rebecca McClear, Director of Technology Operations and Analytics, Access Health CT.
Is that it?
Nope. John
No, we have
Carbone.
more.
Okay.
Good
sorry.
morning, Caroline Ruette, Director of Marketing, Access Health CT.
Hello, Caroline.
Good morning, everybody. John Carbone, Director of Small Group Product Development and Broker Support.
Good morning. This is Glenn Jurgen, Director of Human Resources with Access Health CT.
Good morning.
Good morning.
Tammy.
Sorry, Tammy.
Go ahead.
Sorry, my mic wasn't, my sound wasn't working before. Sorry to interrupt. Susan Richbike, Director of Legal and Governmental Affairs at Access Health CT.
Good morning. Tammy Hendricks, Director of Health Equity and Outreach, Access Health Connecticut.
Okay, I think that's everyone. And I appreciate it. Thank you all very much for the introductions. Marcin, I understand we have no public comments today. Is that correct?
That's correct, Mr. Chair. We did not receive any public comments for today's meeting.
Okay, well then we'll move to the next agenda item, which is to approve the minutes of the last meeting. And I'll ask whether there are any comments, corrections, changes to those minutes. If not, I would ask for a motion to approve the minutes from the last meeting.
Yeah, hi, this is Grant. Motion to approve the minutes from last meeting.
Thanks, Grant. A second?
Tom McNeil, second.
Okay, hearing no discussion. Charlie Klippel, yes.
Thank you. Paul Philpott?
Yes.
Grant Reader?
Yes.
Deidre Gifford? Steven Hernandez?
Yes.
Okay, thank you. Dr. Gifford, Steven Hernandez. Matthew Brockman?
Yes.
Thank you. Thomas McNeil?
Yes.
Dina Berlin?
Yes.
Andrea Barton Reeves? Sean King?
Yes.
And Claudia Gaultier?
Yes.
Thank you.
Thanks very much. Susan Richbike, I think the next agenda item is yours.
Yes, it is. Thank you, Mr. Chairman. We have a vote that is needed today on changes for committee membership. And I just want to point out that pursuant to the exchange's bylaws, the board is required to vote members on and off committees. And there are two of our advisory committees that have requested that they step down, due to their own reasons right now. So we just need the board to vote for those removals.
Before we do we have a thought about replacement or net removals? What's the thought there?
Yes, we do, Charlie. We are currently recruiting, and we have some ideas in mind. But we want to contact those potential committee members before we bring it back to the board. But we are working on replacing both of them.
Okay, thank you very much. So these are requested resignations in effect that we're accepting.
Correct.
Yeah. Yes, and we just want to thank them for their service.
And Charlie, we'll get a letter out to them, or both mine and your signature, and thanking them for their service to the board.
All right. Well, we'll record in the meeting that the board also thanks them for their service. And if there's any discussion, if not, then I would ask for a motion to accept the.
Charles, can you give the names of the two people?
Oh, I'm sorry. Let me read the motion. A motion to remove Ellen Skinner as a member of the Shop Advisory Committee and to remove Holly Hackett as a member of the Health Equity Outreach and Consumer Experience Advisory Committee.
Yes, motion to accept the resignations. This is Grant.
Thank you, Grant. Second.
Second, it's Paul. Second.
Thank you, Paul. Any further discussion? If not, then Charles Klippel, yes.
Thank you. Paul Philpott.
Yes.
Grant Ritter.
Yes.
Deidre Gifford.
Yes.
Steven Hernandez. Matthew Brockman.
Yes.
Thomas McNeil.
Yes.
Nina Berlin.
Yes.
Andre Barton Reeves. Sean King.
Yes.
And Claudio Gualtieri.
Yes.
Thank you.
Thank you very much. James, the floor is yours.
Thank you very much, Mr. Chair. I'll move very quickly as we have a full agenda that we have to get through. Good morning, all, and welcome to our September board meeting. And thank you for joining us this morning. I am James Michel, the Chief Executive Officer of Access Health Connecticut, and look forward to sharing important updates with you this morning. Before we begin, there are a few items I would like to share with the board. We are working with the Department of Revenue Services on a new way to connect with Connecticut residents who are uninsured following the passage of a new law about 2 years ago. Residents will be able to check a box on their tax return for the tax year 2024, requesting information from Access Health Connecticut. Then we will do the outreach directly to those folks that check the box on their tax form. Then we will work directly with them to get them access to health insurance. So that's coming in the next year. There's something that Susan has been working directly with the legal team at the DRS to get this going. So the project is ongoing as we speak to make sure our system is ready to receive that information so that we could get more Connecticut residents access to health insurance. And again, we anticipate this will help us to increase our enrollment numbers going forward as well. Another important update is that Connecticut Holding Inc. is being acquired by Molina Healthcare. We sent some information to the board about that several weeks ago, and we look forward to. We are currently preparing for the anticipated transaction to be completed in the second quarter of 2025. I would encourage you, please reach out to me and Susan if you have any questions as we move forward. But we will, as this evolves, we will keep the board abreast of what's going on and where we fit in with these transactions. And finally, we will be scheduling demonstrations for the new platform for individual covered health reimbursement agreement, also known as ICHRA. And this is, John will give you more information about this shortly, but this has been set up to give small businesses access to the marketplace. If they're qualified, their employees may enroll through Access Health and some, if they're qualified, may qualify for subsidized health. So we think this is a viable option to help small businesses give access to health insurance to their employees. And then also we will be demonstrating these demonstrations will be planned for the board members and elected officials in the coming weeks. We are working with small nonprofits for a soft launch of ICRA on November 1st of this year. Regarding our meeting today, we will begin with a committee update. The strategy committee met last week to discuss several strategic initiatives. These include ICRA, as I just mentioned, and our 10 clicks or less technology project to simplify and improve the enrollment process for Connecticut residents. And also our call center service RFPs. We are assessing 4 RFPs currently to determine which one of them will be our new vendor for call services over the next 3 to 5 years. Then following that, Tricia DeVay, Insurance Actuary Supervisory at the Connecticut Insurance Department, will present the 2025 rate review. Then John Carbone, Director of Shop and Product Development, will bring you up to date on the ICRA project as to where we are currently. Director of Marketing, Caroline Barrett, and Director of Health Equity and Outreach, Tammy Hendricks, will cover the latest enrollment and outreach information for Cover Connecticut. Caroline will then give a report on the result of the recent survey we conducted about the impact of the Affordable Care Act on health and well-being here in Connecticut. We will send that the entire survey, including the executive summary, to the board right after this meeting. Then John and Tammy Hendricks will share broker news, including information on the Broker Academy, certified broker training, and the current number of certified brokers we've access. So that's a request that came from one of our board members at our last meeting. Then Katie Hearn will wrap up our presentation. Katie Hearn is the Associate Director of the Enterprise Project Management Office. She will provide an open enrollment readiness update. Open enrollment, as we all know, will begin on November 1st, 2024, and will run through January 15, 2025. Katie will discuss technology, marketing, and outreach preparation for this period. I will pause now, Mr. Chairman, for anyone with any questions.
Thank you. Any questions?
Yes, Mr. Chair, this is Claudio. If I may just ask a couple things, maybe provide some suggestions. So one, James, I think that's phenomenal that you guys have moved forward with that legislation that was part of the Human Service Implementer 2 years ago to facilitate better data collection, optional data collection between DRS and the tax form and Access Health so people get maximum state subsidies. Have you all reached out to, I know the Human Services chairs have on at least a handful of occasions reached out to me, very interested because they helped shepherd that language through on status updates. Is it possible maybe we can convene a group of key champions and allies in legislatively and folks like the Connecticut Health Foundation, Health Equity Solutions that worked on the authorizing bill just to magnify when you're ready to launch that, and maybe we can have a concerted outreach push to that new access point for more enrollment?
Thank you, Chloe. Yes, we will develop a whole strategy about communicating this new effort around collecting information about the uninsured. Again, we work with DRS directly to develop that strategy, but we will have a strategy, and we will leverage our community partners, our navigators, as well as our Connecticut Health Foundation and other organizations that we've worked with in the past to get the word out.
Okay,
Social
and if I
media,
could
direct, and
ask,
so forth. Yes.
If I could ask if there's some sort of just very simple one pager on that you could share with the board. Each of us have our respective channels, and I think we could be helpful at pushing the word out there as well. I know legislators do newsletters, so it could be ready-made for a late December newsletter announcing this change, and that's another avenue that we could help magnify.
We will do that. We'll do that immediately.
Okay, thanks so much.
Yes.
The other question is on ICRA. Very excited that November 1 is coming around and that there's going to be a soft launch of that new option. I think it's going to be really helpful for small business employers. James, when you and I were talking offline a few months back, you had mentioned that the target audience, at least to sort of build some critical mass, would be around the nonprofit community. So wondering if you could give us a status update. Has there been some initial commitments from some of the key nonprofits? What have been the state of the conversations with the Alliance and other nonprofit representatives?
Sure. Thank you, Claudio. When John gave his update, he would address that directly, direct question for you. But we have connected with some nonprofits, and they have agreed to be part of the soft launch. But John will give you more detail on that when he gives the full update on where we are with ICHRA.
Okay, I'll await that update later. Thank you.
Thanks very much. Any other questions or comments? All right. If not, James, I think the floor is still yours with respect to the strategy committee.
And again, Mr. Chairman, I'm Mr. Repeating. The strategy committee met last Thursday, and we gave them a full update on several items. The ICHRA was discussed at length with the strategy committee. 10 clicks or less technology project to simplify and improve the enrollment process for Connecticut residents was discussed at risk as well. Yeah. And also, we also talk about the call center project, as well as giving the strategy committee an update on where we are as we prepare ourselves for our 12th open enrollment, which starts on November 1st.
Fantastic. All right. Any comments, discussions? If not, then Susan, if you'd be kind enough to introduce our guest.
I will. Thank you very much, Mr. Chair. As you may have seen in the news, the insurance department finalized the rates for 2025 for individual and small group plans on and off exchange. I think it was Friday, September 6th. So today we are very fortunate to have Tricia DeVay here from the insurance department, and she is the insurance actuary supervisor, and she will present the information to us on those rates. And just as a note, Tricia works for Wan-Chin Chow, who was with us last year, who's the chief actuary and assistant deputy commissioner, but he is traveling today, so he was unable to attend. So Tricia has gracefully agreed to make the presentation for us. So thank you.
Thank you, Susan. And good morning, everyone. For those of you who don't know me, I do work in the actuarial division under Wan-Chin Chow, and I oversee the rate review process. And happy to be here to discuss the 2025 health insurance rates in Connecticut. In terms of the scope of the review, we had 7 companies, 7 distinct companies, 8 total rate filings, which covered both the individual and the small group markets. There's approximately 200,000 covered lives in Connecticut. That's roughly 140 on the individual, 60 on the small group. And I did just want to mention before I talk about the actual increase, we did have sort of a major change in the carriers that are participating. For those of you who don't know, I'm sure you do, Cigna and Aetna both announced they would no longer be participating in the 2025 rates on the small group market. So we lost 2 of the carriers. Items contributing to the 2025 rate increases. Annual trend, better known as sometimes medical inflation. This continues to be the major driver in future rate increases. And this is just a factor that accounts for the rising healthcare costs, including the cost of prescription drugs and demand for services and the severity of future claims. Within this, it does incorporate medical costs, which have risen more in line with the high single digits, 8 to 9% we're seeing range for the carriers, but also prescription expenses, which have risen much higher, more in the range of 12 to 19%. These increases are primarily driven by higher utilization and greater disease severity, which lead to advanced stage treatments and overall increase in healthcare spending. In addition to the trend, the next major item, which accounts for usually most of the remaining, is various experience adjustments, which generally are adjustments necessary to reflect deteriorating claim experience from the prior rating period to the current rating period. I also included Medicaid unwinding here. It's actually sort of a subset of an experience adjustment, but I thought it was relevant to include it since everyone's familiar with this happening in the last couple of years. It represents the impact of the current commercial market due to Medicaid unwinding, and really talking about carriers' feeling on how that their population is going to change due to this unwinding, and the impact on the rates due to that. I also would mention, what is not mentioned here is legislation, which we usually have. But I wanted to give it a shout out because it is important every year. But this year, legislative impact was immaterial for all the carriers. Nobody mentioned it as a material impact on the rates for the 2025 rates. All right, so let's just get to the specific numbers and the decisions that were made. I did want to just tell you overall averages. For individual, the average increase requested was 8.3%. We reduced that, and the average will be on the final rates 5.9%. On the small group, the average request was 11.9%, and we reduced that, and it will be 7.8%. And now to go over specific carriers, Anthem Health Plans, and just note that Anthem does offer plans on and off exchange. Their average request was 9%. After our review, the approved final average will be 6.4%. And these do vary by plan. And Anthem currently has roughly 63,000 covered lives, of which over 90% is on exchange. The other large carrier is Connecticut Benefits, Inc. The average request was 7.4%. That has been reduced to 5.1% average. Again, it varies by plan. They have over 73,000 covered lives. Connecticut Insurance Company, Inc. They also currently offer on and off exchange. They have much smaller covered lives, a little bit over 4,000. Their average request was 12.5%. That was reduced to 11.8% on average. In terms of small group on exchange, Anthem requested an average 13.6%. That was reduced to 9.2%. And they have close to 38,000 covered lives, and about 30% of that is on the exchange. Now moving to off exchange. On the individual side, only Connecticut Inc., which is their HMO, the average request was 9.1%, and that was reduced to 7.8%. And they have just about 1,000 covered lives. And now off exchange for the small group market. These are 3 legal entities, all under the United Healthcare sort of umbrella. Oxford Health Plans Connecticut, Inc., that's their HMO. Their average request was 5.1%, and that was reduced to 1.6%. And they only have about 1,000 covered lives. Oxford Health Insurance, which is the largest with covered lives, they requested 8.9%, and that was reduced to 5.3%. And they have over 17,000 covered lives. United Healthcare Insurance Company, They asked for 9%, and after the decision, it was reduced to 5.4%, and they have about 1,500 covered lives. And I don't know, is that the last? If that is the last slide, then we can open it for questions. I think.
First of all, let me thank you for joining us this morning. We appreciate
You're
you being
welcome.
here, and we appreciate the update. I actually have a question.
Sure.
It's just more curiosity than anything. In your opening remarks, you said an increase, significant increase in the severity of illness in the state. Is that sort of a bounce back from COVID, or is there really a change in the morbidity of the state somehow?
My understanding from the carriers that that's not COVID specific. That is just that relates to everything in general. That's what we're hearing from the carriers.
Wow, that's a interesting observation. All right,
Hey, Charlie,
thank you for that. Let me, yes, please. Any other comments besides mine? Thank you.
Yeah,
for
Charlie,
questions.
it's Paul. I got a question.
Sure.
Yes, please.
The question has to do with the average age of the insured group. Can you tell me if that age has been stable? Has it been going up the last few years? Where are we with that?
That I actually don't know. I don't even think I have the information to probably get that, but I could certainly get back to you on that, and I'd have to reach out to the carriers. Probably a good point to know if it's.
Well, that might help explain the increase in morbidity.
It certainly could. Yeah, it could.
Maybe it'd be helpful if we had that information.
Okay. Yeah, no, I can follow up on that. I'm sure the carriers should have that type of information.
Appreciate it. Thank you.
I mean, at some point you age out. I mean, you move on to Medicare. So at some point it's going to level, and you would hope you'd get people coming in at the same rate going. But I think it's a good question. I can follow up.
Appreciate it.
Yeah.
Dr. Gifford has a question. Thank you.
Thank you, Mr. Chair. I just wanted to reflect, thank you for the presentation. That these increases, just at my gut reaction is that they seem more modest than in recent prior years, which is obviously good news. I will share with the board that our state has set a target for cost growth of 2.9% between 2024 and 2025. So even with these more modest increases in rates, we are not really coming close to, in at least as reflected in this this element of spending, we're not really yet coming close to hitting our overall spending target. We did have the opportunity, thanks to CID, to ask the carriers about their efforts to meet the benchmark. And I think it's fair to say, and others who were there could offer their interpretation. I think it's fair to say that the carriers had two general responses. One is that they don't really consider the benchmark because they use their actuarial methods, which are different from the considerations in the benchmark, which are growth in household income and projected gross state productivity. So that's a challenge that we have. And the other is that they repeatedly said that they are unable to control the medical inflation because of healthcare consolidation and their difficulty in negotiating with some of the larger systems. So I think, you know, I don't think as a board, Charlie, had a conversation about the role of the exchange in affordability. And in fact, some of the carriers were a little bit dismissive about affordability as an issue because they said, well, there's all these subsidies on the exchange, so your customers don't really feel it in their pocketbooks, which is, you know, obviously there are more considerations. So I think at some point it would be good for us to talk about as a board, maybe at a future agenda, how or if the board wants to weigh in on some of these affordability challenges and the ways that we can work to meet the benchmark collectively. Thank you.
Mr.
James,
Chairman.
yeah,
yes.
please. No, I was just going to say I would welcome that discussion. So let's find the right time to have that discussion as a board.
I would suggest maybe having a workshop.
Good idea.
In the near future, and then maybe bringing some knowledge, some experts to work with the board and along with Dr. Gifford's focus and kind of forge a way forward. And also more important, see how the exchange could be of help in guiding down the right path. But maybe a workshop down the road might be an appropriate way to do it rather than having that at a board meeting. So I'll work with the board. I'll work with you, Charlie, to come up with a date that fits for the whole board. And we'll pick a location. Hopefully we all can be in person. If not, then we'll do it virtually. But more to come on that.
Perfect. All right. Dr. Gifford, does that seem sensible?
Yeah.
Let's do it. Okay, fantastic. Thank you very much. Dina Berlin.
Hi. Yeah, I found the testimony of the insurer somewhat frustrating at that hearing, and I was glad when both the Attorney General and the Insurance Commissioner pushed back to some degree and said, well, would you like state help here? Would you like us to do something like Rhode Island does where they say you can't sign a contract that goes up more than inflation? And I did find that particularly one of the people testifying, the one who testified for Anthem, made some claims about legislation that were false. And Senator Looney sent a letter to them expressing his frustration with the assertion that the legislation to limit formulary changes during the year and also make some patient protection and prior authorization, they said that those were drug company driven, and that's actually a false narrative. And Senator Looney did also send a letter to the Commissioner of Insurance saying, totally agree with your ideas of what we might do, and let's work together on things like, making it so that they can't sign a contract with a hospital that's, so much higher than what inflation is. Because they were back at the same thing. They always say, oh, we're shameless. We're helpless. We can't do this, et cetera, et cetera. And the insurance industry is pretty consolidated itself. So I think they're, not necessarily genuine. And in addition, they always say that the medical loss ratio is a price control. It absolutely is not, right? Because they don't care whether 20% of 1,000 is more than 20% of 100. So they're not that unhappy at paying, getting, having to pay 1,000 if they have, 20% of that to use on administrative costs. So I personally found their testimony pretty frustrating.
Thank you. Any other comments or questions?
Charlie, just one quick follow-up to a question that Paul asked on the exchange, and given that the exchange has the largest, the lion's share of the individual insured on the exchange, our biggest group on the exchange is the group that ages from 55 to 64. That's every year that's growing more and more. So Paul, there's some validity to your question that maybe the drivers of the increased costs in healthcare might be folks aging up towards Medicare. But our largest group, about a third of our enrollees are aged between 55 and 64.
Right. Well, that sounds intuitive, right, James? Because the demographics of the state kind of confirm that too.
Correct.
So anyway, thank you, but I think that'd be helpful information.
Perfect. Any other questions or comments on this session? One other thing that struck me was how small the insured small group market is getting in this state. And I think that's a good segue into our next discussion on ICRA. So Ms. Deve, thank you very much for joining us today. We really appreciate your insights.
Oh, you're most welcome. Thank you.
Sorry.
No, go ahead, Charlie.
next topic, I believe, is John Carbone.
Yes, sir. Good morning, everybody. Hope everybody's doing well. John Carbone, Director of Small Group Product Development and Broker Support. Today, I'm excited to share an important update on the Individual Health Reimbursement Arrangement, also known as ICHRA. The Individual Coverage Health Reimbursement Arrangement was established in June of 2019 by the United States Department of Treasury, Labor, and Health and Human Services, offering employers greater flexibility in providing health benefits. Officially taking place on January 1st, 2020, ICHRA makes a shift towards more personalized approach health coverage, empowering employees to choose individual plans that best fits their needs and helping employers manage benefit costs more effectively. Under the IRS guidelines, if ICHRA offers a considered affordable health plan, employers are ineligible to receive advanced premium tax credits. However, if they offer an unaffordable employees can opt out to decline the ICHRA instead and apply for APTCs, advanced premium tax credits, to reduce the cost of the market health insurance plan. Importantly, employees cannot combine ICHRA funds and advanced premium tax credits for the same coverage. That's an extremely important part of ICHRA. It's one or the other. It is not both because the IRS does not allow that. Overall, ICHRA provides a personalized, cost-effective solution that allows with the diverse needs of today's workforce and offers flexibility for both employees and employers. So over the past 6 months, our team at Access Health has been carefully evaluating all the different types of platforms that are out there and determine the best fit for our needs for our Connecticut residents. After thorough consideration, we decided to develop our own technology platform. The decision ensures that both employers and employees can make an accessible and streamlined experience when enrolling with the full support of our dedicated broker community. I'm pleased to announce that this new technology platform is way underway. Starting the week of October 15th, we will begin meeting with key stakeholders to demonstrate this platform. These stakeholders include the office of the governor's office, the Access Health Board of Directors, Real Estate and Insurance Committee, our Comptroller's Office, Anthem, Connecticut, and our local broker associations. Looking ahead, though, on November 1st, we will be initiating a soft launch of this platform and accompanying it with a comprehensive marketing plan. During this phase, we'll collaborate with 10 to 15 groups to ensure that our platform integrates smoothly with our existing system and complies with all the IRS, CMS, and ACA requirements. This soft launch will extend through Q2 2025, giving us ample time to gather all the necessary information and feedback, make any adjustments to the system so we can perfect it. By July 1st of 2025, we plan on rolling out a fully enhanced platform, bringing new levels of innovation and needs to the marketplace. We're generally excited about the development and the positive impact that this will have with our clients, partners, and community. Claudia, to answer your question, we are going to be working with different types of market segments through our broker community. This is an extremely heavy broker community, so we want to make sure that we bring in all the necessary cheerleaders to make sure the product does go out to the right individuals. Non-for-profits are a big focus on this because we understand how they stretch every single dollars and how the pay scale in those environments are vastly different from the directors all the way down to the individuals doing the outreach. We feel that this product will allow us to kind of look at all the different types of classes that we have to establish through this and make sure that they work appropriately and we meet all those requirements that we have to through the IRS, CMS, and ACA. So I'd like to thank everybody for your attention, and we look forward to keeping you updated in the future on this. Any updates? Any questions?
Claudia, if there's anyone specifically that you want us to reach out to, let us know to include in the soft launch. But we've identified about 15 small nonprofits. We typically they do a lot of community service type of work, and the frontline folks tend to be lower wages. So we think that that's a rich environment to really give people access to more options, not just lower and not just subsidized, but also more options. Typically, they may have 1 or 2 options available to them. With us, they'll have up to 22, if possibly even more, if they qualify for co-sharing we think this could really be a home run for the small business, especially those who are struggling with cash flow, but still want to offer health insurance to their employees. And by extension, we think this is also going to grow the individual marketplace in the state of Connecticut as well.
Yeah, and that's why I'm so excited about this, James. And I thank you and this update. I would suggest potentially we can have a conversation with Giancarlo Casa from the Alliance. They do technical assistance webinars and also have a library of resources for their members and for other nonprofits. I think if we can sort of do a webinar that people can view at their leisure and that they could push through their membership organization. They also have at the end of the year, which may be timely in December, they usually have an annual conference. Perhaps we can ask to do a session, a breakout session on this. So some of those individual small employer CEOs that are there, the nonprofits could just workshop it with us, ask their questions, and really start to dig into whether this makes good sense for them from an affordability perspective on how they can recruit more employees for them and obviously build out the exchange and create healthcare affordability for their employees. So I think that there's really some great ample opportunities in this next few months. So let's do an offline, and maybe I could even join if Dr. Gifford, I don't know if I'll sign you up as an optional guest to maybe just facilitate some conversations with the nonprofit communities, and together we can brainstorm some opportunities to get the word out.
We welcome that. Thank you very much.
So well, we have a whole marketing strategy that we have developed. Marketing and outreach strategy. So this fits into our strategy to get the word out ahead as early as possible, so people get acclimated to what's coming. So Claudia, we'll reach out to you and with Dr. Gifford and to get your input. Then we'll take it from there.
Yeah. So what I was offering is I will be I'm willing to be part of 2 or 3 tactical, concrete tactical initiatives that could feed into your broader strategy. I don't mean to rewrite your strategy. I just know we have some deep connections with the nonprofit community, and I see this as sort of a win-win. And as a facilitating, on behalf of OPM that facilitates across agencies and looks at provider networks that serve our human services agencies, I just want to use those channels to maybe suggest a few very concrete tactics that fit in your strategy.
Yeah, we welcome all the help at all because, as you know, we are small organizations. So more help we get from the board, the better we all will be. Thank you.
Dr. Gifford also has a comment, I think. Thank you.
Thank you, Mr. Chair. So I just have a request, if I could. Claudio has been doing a valiant job of trying to educate me about ICHRA, but I still find it somewhat of a challenging concept. So I would like to request a simple example for an employer that says, here's what you pay now for premiums, and here's your employees' out-of-pocket costs, and here's what that would look like if you were to join this initiative, with some actual numbers, so that those of us on the board and also employers can see how the input of the employer changes, if at all, and what the impact is on the employee and where the federal subsidies come in. It's a little bit hard for me anyways, to grasp just in words. And I think a graphic with some examples would be super helpful. But I also want to join Claudio in saying thank you to everyone at Access Health for moving this forward, because I think it has the potential to answer a lot of the requests that we constantly hear from small businesses who are struggling to provide affordable care for their employees.
So, Dr. Gifford, I'll let John comment even more, but that's precisely what we are working on creating, taking a real company right now that we know about in a small nonprofit, a real one, have all the information and put them, this is where they are right now. If they're coming to ICHRA, this should be the impact to them, to the employer and the employee. So you'll see the numbers in 3 phases. Currently, where they are, come to ICHRA, impact to the employer in terms of savings to the employer as well as the employee, more options they're going to have, as you might imagine, if you have a workforce between the age of 25 and 60, 60-year-old and 25, you have different healthcare needs. But if you only have one plan, if you only offer one or two plans, then that's relatively unaffordable because of high deductible costs. To a 50 or 60-year-old, that might be very expensive. So you come to the exchange, you have more options available to you on the exchange. So a 60-year-old could pick a gold plan, and a 25-year-old may pick a bronze plan. So that's one of the benefits to the ICHRA would give to small businesses. In addition to those who qualify, may be able to purchase their healthcare subsidized through the exchange as well. But that's precisely what I asked John to create this document that's going to show current state for real business, employers, employees, then come to ICHRA, and what's the impact to them after they're on ICHRA. So we are creating that as you requested from us.
Also, that Dr. Gifford,
because you know how complicated it is. I'm sorry, John. Go ahead.
No, Dr. Gifford. Just to add in a little bit to this, this is we may make it seem very simple and kind of extremely high level. This is a product that we've been working on since COVID, trying to hopefully wait for the technology to catch up. We've chosen not to wait for the technology to catch up and simplify it, because everything we've looked at, we've went through about 40 to 50 different webinars, and the technology has just made it more complex for brokers and employers. The thing is going to be is we're going to simplify this to where you can be able to do all those analysis right on the technology platform and see, hey, if this employer put these individuals in the right classes and they did qualify for APTCs, that employer no longer would have to provide that contribution for that member because they're eligible for ATC, but still have that group feel in it. So we'll be more than happy to show you all those examples and show you how we simplify it and how the different avenues, because it's just not the employee, it's the employer will hopefully have some cost savings that he or she can go out and continue to grow the business, and that employee will have different types of options. Because in the small group world, usually what ends up happening is carriers allow you to have one or two plans. Those one or two plans don't fit their needs sometimes, and it's either a bronze plan and maybe a silver plan. Now they're going to have a variety of different plans, and they're going to have some skin in the game to choose the right plan, so they're going to feel more empowered about it. But for the cost savings for the employee and the employer is something we're developing and showing in the platform and outside the platform with marketing pieces. So stay tuned. We'll make sure we get those out to you. And we more than have conversations.
Those are going to be very helpful. I think I second Dr. Gifford's call for as clean and simple and sort of real life an example as you can, or two that you could provide would be great.
Yeah, we've been hearing that nonstop. Yep, we will do it.
Thank you. Ms. Berlin, you have a hand up, and I don't know whether it's a carryover or you have a new question or comment.
I just wanted to say that the ICHRA thing, it's kind of exciting if it's going to be sort of an alternative to this junk stuff that some people are using, like the attempt to do the association health plans and the level funded plans. It would be I think a much better option and hopefully equally as affordable, right?
The goal is for us to provide them different types of options. So we want to make sure they can evaluate everything out there, because it's not going to be a total fit for everybody, but we feel like it's going to be a fit for a lot of individuals, but it will give a creative option. So that's kind of how we look at it. We're calling it an additional tool in the toolbox to hopefully help our broker community and employers and employees here in the state of Connecticut look at different options. As you can tell, we just have to simplify it down to a common denominator and make a very complex product easier.
Any other comments or questions? James, I have a concern that we have an executive session at the end of this meeting, which I think is scheduled between 9:50 and 10 o'clock, and I really don't want to lose that. So we're more than a little behind here. If we could think about how to maybe address one more topic, but leave us enough time for the executive session, it would be very important.
So maybe let's talk about the survey. Then we put everything else on hold until October.
Thank you.
Actually, you know what?
Oh, no,
Dr.
let's talk about readiness.
Readiness, okay. Dr. Gifford, can we send you the update on Cover Connecticut? I know you had, that's a request that came from you.
Yeah,
We
of
got that.
course.
Okay, thank you very much. We had laid it out. So we'll send you what we're going to update. And also, if you have any specific questions, we could schedule something with you as well.
Thank you.
Thank you. So Katie, Charlie, you said readiness for OE, right?
Well, just we would make us all comfortable to know that we are ready. So please give us a quick view of that.
Sure. Hey, Katie.
Yes, thank you. Good morning. My name is Katie Hearn. I'm the Associate Director of the EPMO, and I can turn my camera on. I apologize. We are currently tracking 19 projects, and we've been steadily preparing for open enrollment 12. Over the past several months, we've been meeting regularly with all of our stakeholder departments to get on track for OE. And as James mentioned, OE 12 is expected to run from November 1st through January 15th. I have some brief updates to share in the areas of technology, marketing, and health equity and outreach. First, with the technology slide, I wanted to highlight that this will be the first OE where we will be able to crosswalk and auto-renew those enrolled in catastrophic health plans. Those no longer eligible for catastrophic coverage can now be crosswalked into another plan and auto-enrolled into that coverage for the first time. So just as a reminder, catastrophic plans are available to those under the age of 30. They may also be available to those 30 or older if they qualify for a hardship or an affordability exemption. That's a change we have this year. I'm going to skip down to the new eligibility for deferred action for childhood arrival individuals, or DACA individuals. DACA individuals will be able to enroll for the very first time in qualified health plans, and they will potentially be able to receive financial assistance through Access Health. And then at the strategy committee, we were asked to provide some projections for OE. So Rebecca McClear, the Director of Technical Operations and Analytics, has shared these numbers. For qualified health plans, we project 150,199 individual enrollments. That's including Cover Connecticut. And then for standalone dental, we're projecting 14,526 enrollments. Just for some context, currently our QHP enrollments are at about 136,500, and Cover Connecticut is at about 36,300. And for dental, we're at about 12,300 currently. Next slide, please. For marketing, we just wanted to let you know that marketing is activating its focus group feedback to assist with its multimedia marketing campaign. It is finalizing its media plan, paying attention to underserved and uninsured communities. The marketing department is also in the process of preparing its PR strategy. It is also sending direct-to-consumer content via mail, email, and text messages, and communicating to consumers who may be eligible to renew Covered Connecticut coverage or enroll into Covered Connecticut for the first time. And we have prepared materials for the DACA population, and that will be posted on our website for OE. Next, please. And finally, as you know, each month, virtual healthy chats are scheduled and open to the public. We also hold community partner chat and learn meetings online for our community partners. And we have plenty of in-person help, again, available this year. We will have 24 enrollment fairs. We have our navigator organizations located throughout the state. And we also have our standing enrollment locations in both at both the East Hartford and Stamford Public Libraries. Thank you.
Thank you for the update, Katie. We appreciate it very much. If I could ask the directors and James Michelle to join us on the executive session link, I would appreciate that. Thank you very much.
Mr. Chair,
We need a
vote.
I'm sorry, Marson?
You need a vote to go into executive session?
Oh, I'm sorry. If I could have a vote to move to executive session, to the purpose of for a 5-minute discussion with the CEO of Access Health.
Mr.
Could I have
Chair,
a
would you like to formalize the motion? Can I just say it aloud?
Yeah,
or
please.
you could do that.
Yeah.
Chair requests a motion to go into executive session to discuss personal matters exempt from disclosure under CGS 1-200 parentheses 6 parentheses A. Is there a motion?
So moved, Paul.
Second,
Matthew.
Okay.
Charlie Klippel, yes.
Thank you. Paul Philpott,
Yes.
Grant Ritter,
Yes.
Deidre Gifford,
Yes.
Steve Hernandez, Matthew Bracken,
Yes.
Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Andrea Barton Reeves, Sean King,
Yes.
and Cody Galtieri.
Yes.
Thank you. Mr. Chair, would you like to read out what's on the annotated agenda?
Or you could. Let's see. Oh, at this time, the members of the board will disconnect from the this one from the committee call-in number and connect to executive session call-in number, which hopefully you all have. And at the end of that, we will then reconvene on this number and close the meeting. Thank you very much.
Thank you.
Hello?
Hello, Mr. Philpott. So we're waiting
Yeah.
for other members to rejoin the
Okay.
meeting.
Okay.
All right, Marcin?
Yes, Mr. Chair, I think we're just waiting for the adequate number of voting members to be present.
Perfect. I hope we still have an adequate number of voting members, but let's do that.
And Mr. Chair, I don't know if you saw my message. In addition to voting to come back into the meeting and to adjourn, we also just need a vote about skipping agenda items H, I, and J, because they were on the agenda. Sorry, my apologies.
Okay, let's.
And Marcin can combine the last two if you'd like, to, the roll call to make it simpler.
Yeah, fantastic. Marcin, let me know when we have enough people.
Yes, Mr. Chair, I'm currently counting. We have 5, and we do need to have 6 members.
Uh-oh. And what do we do if we don't get the 6th member?
I will defer to Susan.
I guess you can't vote technically without the 6th. Did everyone know to come back on?
They did, although I think we may have lost people just going to the executive session, so.
Well, I guess we're going to be stuck in this meeting then, huh?
No.
This will be a perpetual meeting.
We will not do that to you, I guess. I guess technically then the meeting sort of
Hold
ends.
up, Marcin, we still don't have 6? I'm counting 6. I thought I heard Paul Philpott.
Yes,
Oh, we do. I think we do have 6, right? Paul is on.
Yeah, I'm on.
Yeah, Paul is on.
I think you do have 6. Thank you, James.
Yes, we just got it. Yes, that's correct, James. Thank you for helping.
Thank you.
So, Mr. Chair, there needs to be a vote to come out of the executive session.
Okay, can I have a motion to vote to come out of the executive session? We'll try to do that.
Hi, this is Grant.
Thank you. Second?
Second, Tom McNeil, second.
Charlie Klippel, yes.
Okay, Paul Philpott,
Yes.
Grant Ritter,
Yes.
Dietrich Gifford, Steven Hernandez, Matthew Brockman,
Yes.
Thomas McNeil,
Yes.
Dina Berlin, Andrea Barton Reeves, Sean King,
Yes.
thank you, and Claudia Gualtieri. Thank you.
Okay, we have one more or 2 more votes, but just to close out the meeting, and I believe, let Marcin, Kari, can you frame this vote for adjournment and postponement of the other topics?
I would defer to Susan on the motion.
Sure. Thank you. You'll need thank you, Marcin, and thank you, Mr. Chair. We just need a motion to change the agenda to skip items H, I, and J today, and then to adjourn the meeting.
Could I have a motion?
That sounds like a great motion that I'd be happy to make.
Thank you. Second?
Seconded.
Tom McNeil, second.
Thank
I'm
you
sorry,
very much.
who made the motion, Mr. Chair? I didn't get it.
Matthew
Brockman.
Okay,
Matthew, thank you.
thank you. Roll call, Charles Clipple.
Yes.
Thank you. Paul Philpott,
Yes.
John Ritter,
Yes.
DJ Gifford, Steven Hernandez, Matthew Brockman,
Yes.
Thomas McNeil,
Yes.
Dina Berlin, Andrea Barton Reeves, Sean King,
Yes.
and Claudio Gualtieri. Thank you.
I want to thank you all very much. Sorry for the little rush at the end here, but really appreciate all the efforts. Thank you, and we look forward to the next meeting with all of you. Bye-bye now.
Thank you.
Thank you.
Hey,
Thank you.
I
Bye-bye.
know.